because you know you're going to lose the other two.
The committee will come to order without objection. The chair is authorized to declare recesses of the committee at any time. Today, our committee is taking another bipartisan step forward to improve Medicare for our nation's seniors. We'll be considering one bipartisan bill, the Protecting Seniors Access to Medicare Act of 2017. This legislation by Republican Congressman Phil Rowe, Democrat Congressman Raul Ruiz, repeals the Independent Payment Advisory Board, or IPAB, created in Obamacare. And the bill has significant bipartisan support. In fact, it has 43 Democrat co-sponsors. One of our main priorities in healthcare is to empower patients, families, providers, and states. We want to give the American people, not Washington, more control over their healthcare decisions. That's why this legislation is so important. The IPAB was created under Obamacare as a way to cut costs in Medicare. But really, the panel is just a way for Washington to cut corners, taking Congress and the American people out of the decision-making process in healthcare. While IPAB's board members have not been appointed to date, here's how it would work. This board would be made up of 15 unelected bureaucrats with unprecedented unilateral powers. These 15 people would have the ability to push forward sweeping Medicare cuts just to keep program spending at some arbitrary level. So that means 15 bureaucrats who we don't know could slash payments to thousands of healthcare providers, forcing them to stop seeing Medicare patients. It means 15 bureaucrats could decide where millions of seniors can and cannot receive the care they need. It means 15 bureaucrats have de facto authority to ration care for millions of Medicare beneficiaries, all without accountability, without judicial review, and without transparency. And if these board members are never appointed or confirmed, cuts will still occur, as the Health and Human Services Secretary would be solely responsible for developing the legislation to cut Medicare to achieve the savings target. Putting Medicare on sustainable financial footing is a top priority for this committee, both Republicans and Democrats. But passing the buck to a handful of unaccountable bureaucrats is not the right approach. Rather than take control away from the American people, we should expand choice, access, flexibility, and the competition in Medicare. And we can start right now by passing this bill to terminate the IPAB once and for all. Our committee has voted several times to repeal the IPAB, and each time it has received strong bipartisan support. I hope that this bill by Congressman Rowe and Ruiz, who are both doctors themselves, will receive the bipartisan support it deserves. And though neither of these congressmen are members of our committee, I'd like to say I'm grateful for their hard work and their leadership on this important bill. We all recognize that repealing the IPAB is crucial to maintaining and expanding access to high-quality care for our nation's seniors. And I encourage all the members of our committee to join me in moving this bill forward. I'd also like to make clear that action on this important legislation doesn't stop after this markup. We will look to find a way to advance this crucial piece of legislation on the House floor, including as part of other must-pass pieces of legislation. With that, now I will recognize Mr. Levin for his opening statement on behalf of Mr. Neal.
Thank you, Mr. Chairman. Mr. Neal is at another meeting or event which requires his participation. He'll be here shortly as we discuss this. This proposal relates to a board that now it's expected will not come into operation at the earliest in 2022. There's no pay for in this bill. The estimate is that this bill would essentially require us to come up with $17.5 billion. So I want to talk, if I might, on behalf of all of us on the Democratic side, about your reference to bipartisanship. We need bipartisanship right now on something that is right in front of us. And so far, there has been no willingness on the part of the Republicans to do that. Mr. Chairman, we sent you a letter a month ago asking that we sit down and talk about necessary actions relating to market stabilization. And I think if we work together, we can find ways to do that. So far, we haven't received a response, while the Senate, Republicans and Democrats have been moving actively in this effort. So, Mr. Chairman, I really urge on behalf of all of us, not only Democrats on this committee, but Democrats in the Congress, but the people of the United States, Mr. Chairman, for you to agree to sit down with us or let the subcommittee sit down and talk about these issues. About cost sharing. As we know, 7 million people, their insurance is at stake for its continuation. Also, provision for outreach and enrollment. We received in Michigan just a week or two ago the notice that there was going to be a cut in Navigator funding for the main outreach entity in Michigan by 90%. By 90%. And we need to sit down, Mr. Chairman, and talk about how we can avoid that. We also need to talk about programs that relate to risk mitigation to bolster the insurance market. You all say that you believe in the importance of the private insurance structure. We should sit down, Mr. Chairman, either in committee or in the subcommittee right away and talk about these issues. So we await your answer. Instead, we're meeting here today to talk about an organization or an entity that is not going to come, latest prediction, into operation until 2022. And once again, we have no idea of the pay-fors. And I want to end by referring to the pay-fors for the CHIP legislation. Currently, it's being marked up in the Energy and Commerce Committee, and the pay-fors that have been presented would raise premiums and cause many to lose coverage. And I hope, Mr. Chairman, that we will actively participate with the Energy and Commerce Committee to make sure that any pay-fors for CHIP are pay-fors that can have bipartisan support. So I just finish just saying to you, Mr. Chairman, you referred to bipartisanship and CHIP, bipartisanship on numerous occasions in your opening remarks. Will you today tell us that you're willing to have this committee or the subcommittee sit down on a bipartisan basis and discuss possible ways to shore up the insurance market? And if I might, I'll yield to you for an answer.
Well, I'll be glad to respond when you're completed.
I've finished.
Great, thank you. So we certainly agree issues need to be addressed. Your letter put it related to the terrible flaws created by the Affordable Care Act. One major flaw is the existence of the Independent Payment Advisory Board. Today, we are holding a markup to act on bipartisan legislation to eliminate this unnecessary and potentially destructive body. You asked about hearings. Ways and Means Committee has held dozens of hearings since passage of the ACA, discuss options to provide common sense reforms to lower costs and provide relief. We'll continue to adhere to regular order, including hearing from witnesses on both sides of the aisle. We look forward to continuing to work with all of our members to craft bills that find, as you previously noted, common ground for the good of the American people. Thank you, Mr. Levin. We'll now proceed to consideration of H.R. 849, the Protecting Seniors Access to Medicare Act 2017. Without objection, the measure will be considered as read and open for amendment at any time. This time, I offer an amendment of nature substitute which was distributed in advance, along with the green sheet explaining it. Without objection, the amendment of nature substitute shall be considered as read, open for amendment at any point, and considered base text for purpose of amendment. I'll now turn to Emily Murray, the Staff Director for the Health Subcommittee, to provide the technical description of the amendment, nature of substitute, with an emphasis on the changes that have been made since introduction. I ask that members hold their questions until after her presentation. Ms. Murray, you're recognized.
Thank you. H.R. 849, the Bipartisan Protecting Seniors Access to Medicare Act of 2017, was introduced by Representatives Rowe and Ruiz on February 3, 2017. H.R. 849 would repeal the Independent Payment Advisory Board, or IPAB, under Sections 3403 and 10320 of the Affordable Care Act. As noted on the green sheet, the chairman's amendment would make a technical change to the short title. Mr. Chairman, that completes my walkthrough. I'm happy to answer any questions.
Thank you, Ms. Murray. Are there questions on the amendment in the nature of substitute? Mr. Levin, you're recognized.
Yes. What's the latest estimate as to when this board would come into operation?
So according to the trustees' report, which was issued in July of last year, they were looking at 2021. We don't have a formal CBO estimate at this point, but that's according to the trustees.
Have you asked for one?
Pardon?
Have you asked CBO for their indication?
Correct, we have. You can look at previous accounts in their baseline from June, and we have sort of unofficial, information from them. And I think you'd indicated in your opening statement that 2022 was a year that they were looking at as it being triggered.
Okay, I think it's important we be forthright about that. What's the estimated cost of this bill?
As you had also alluded to in your opening statement, $17.5 billion is the latest that we have.
Is there a pay for in this bill?
In the legislation in front of us, it simply repeals the Independent Advisory Board.
Do you remember the pay for when this came up the last time on the floor?
I do.
What was it?
It was rescinding funding from the Public Health and Prevention Fund from the Affordable Care Act.
Mm-hmm. How much is left in that fund?
At this time, I don't have that estimate in front of me, given that that was used for the bipartisan cures legislation that was enacted last year.
And what's been the use for the prevention fund?
I apologize.
What's been the use of monies from the prevention fund? You know?
Currently, I believe the Appropriations Committee has found ways to use the prevention fund as part of their appropriations process or use that. So I would have to get back to you on specifically what programs that has gone towards.
Thank you.
Thank you, Mr. Doggett.
Thank you very much. So I understand this will cost $17.5 billion, and under our budget resolutions, we'll have to find an offset at some point after this committee meeting, I assume. You have to get that money from somewhere.
Decisions as to next steps will be determined by the members.
So you'd either, if you don't borrow it from the Chinese and the Saudis, you have to cut something else to make up for the $17.5 billion.
The determination of whether or not this will be paid for and how will be up to the members.
Okay. The members will decide whether we add $17.5 billion to the national debt by borrowing it from afar, or whether we cut something else in the healthcare area, or raise the revenue by raising premiums, which is what is being proposed in the Children's Health Insurance Program today. So I want to explore with you what it is we get, what benefit America gets from $17.5 billion of cuts, or borrowing, or raising the cost of health care to seniors. If we decline to pass this proposal as you have described it this morning, what impact will that have on any health care provider or any health care consumer in America this year?
This year, since it has not yet been triggered, there will be no immediate impact.
No effect for $17.5 billion. How about 2018? Will there be any effect on any healthcare provider or any healthcare consumer in America for this $17.5 billion?
Based on the last estimate from the trustees that was provided in July of this year, the answer is no. However, each year they will provide an estimate where they update whether or not the cuts will be triggered. So we will see it next year.
Thank you. No effect this year in 2017, no effect in 2018. How about in 2019? Will there be any effect that year at all on any healthcare consumer or any healthcare provider for $17.5 billion?
We will have to wait for the trustees' report to be released.
But
next
you know of no effect because you've already said that you don't expect this to go into effect until 2022. Was that the right year?
That is what CBO has estimated.
That's the estimate. And you don't have any basis at this point for quarreling with that estimate, do you?
No, every year Congress waits for the trustees to put out the proposal as
Right.
required under statute.
So no effect in 17, in 18, in 19. The same would be true of 2020. No effect on any healthcare consumer or any healthcare provider anywhere in America in 2021, all for the price of $17.5 billion to be borrowed and added to the national debt, taken out of the pockets of seniors or other Medicare beneficiaries in higher premiums, as Republicans are proposing today for the Children's Health Insurance Program, or cutting some other vital health care program. It looks to me like a major, major mistake. Thank you.
Mr. Kind, you have a question as an amendment of the nature of substitute?
I do. Thank you, Mr. Chairman. Ms. Murray, thank you for being here and answering our questions today. My first question, does the current IPAB allow for a fast-track process that would have repealed IPAB for good through a joint congressional resolution?
If Congress had acted by August 15th of this year, that would have been true. However, the House, through the Rules Committee, has actually turned off the fast-track process established under the law. So the House is currently under no expedited process or procedures.
Right. If we had acted by August 15th, though, there would have been a no cost associated with repeal of IPAB. Is that correct?
That is not our understanding.
Well, that was the feedback that we got from the chief actuary, and that if we had acted with a joint resolution by August 15th, there wouldn't have been any cost, no offsets that were required.
So while there had not been anything triggered for this year, we don't have any formal score from CBO on what the cost would have been for such a resolution.
Well, now we're first week of October, and apparently, according to the chief actuary, a repeal of IPAB would cost $17.5 billion. Is that correct?
That is correct.
Assuming we want to pay for it, and not, as Mr. Doggett pointed out, just added to the national debt at this time. Is that right?
Based on the latest estimate, that is correct. I would note that the last time the committee marked up this legislation, the score at that time was $7 billion. And it's continued to change every year based on Medicare spending and the target rate.
It sure does. In fact, when the Affordable Care Act, or Obamacare, first passed in 2010, the earliest date when IPAB could have been invoked was 2016. And then, based on the growth rates, that was pushed back to 2018. And then, based on the growth rates again, it's now currently pushed back to 2022. Is that correct?
According to CBO's estimate, correct.
Can you tell us, has an IPAB commission even been constituted today?
Currently, there have been no board members appointed or confirmed in the Senate. However, if there are no board members, then the Secretary of HHS is required to instead come up with the proposals.
And the whole invocation of the IPAB Commission really rests on the chief actuary of CMS, that we're exceeding the per capita growth rates under Medicare. Is that correct?
Correct.
And then at that point, the commission would meet and they would come up with certain recommendations that they would submit to Congress in order to get the growth rates back under the targeted rate again. Is that right?
Correct.
But Congress doesn't have to accept that recommendation. Is that right?
If Congress fails to enact legislation that has the same amount of cuts as was suggested by the board or the secretary, then that would automatically be implemented by the Secretary of HHS.
But the committees of jurisdiction still have discretion to look at the IPAB recommendation and say, hey, we think you're crazy, and we're going to do something different. Is that correct?
The committees of jurisdiction would have about 2.5 months to come up with an alternative proposal to then report to the House floor.
Right. So it still rests within our discretion. If we want to try to keep per capita spending in Medicare within a certain growth rate, nothing is prohibiting this committee or Congress itself working to come up with our own bipartisan solution to it. Is that right?
That is correct.
And just so we're clear, under the statutory language of IPAB and how it's constituted, IPAB today is prohibited in law from making any recommendations that ration care. Is that correct?
That is correct, though the term
And
ration
so
is
the
not defined.
chairman's opening statement, that we have an unelected bureaucratic board making spending reductions that could lead to rationing care, is in fact explicitly prohibited under current law. Is that right?
Current law does not state what rationing of care is defined as. However, it does allow for unlimited ability or authority to cut payments to providers.
Yeah, but the actual language, rationing care, is in the law. Is that right?
The word rationing.
It's also prohibited from making a recommendation that would increase cost sharing. Is that right?
Directly to beneficiaries.
Or an increase in premiums, or even an increase in taxes under the current law?
That is correct.
Or even, IPAB is specifically prohibited from reducing any benefits that beneficiaries currently receive?
By directly doing so, correct.
And right now, there's nothing that compels Congress to move forward on legislation to repeal IPAB, since the board isn't even constituted, and we're not even exceeding the growth rates. And in fact, isn't it true that the per capita spending in Medicare right now is at a 50-year low since the passage of the Affordable Care Act, or Obamacare?
I would note that last year's trustees report had indicated that they thought 2017 would be the year in which IPAB was triggered. So there.
But I didn't ask you that. I asked you whether or not, with the current per capita spending in Medicare, it's at a 50-year low since the passage of the Affordable Care Act.
I'll have to confirm that that is in fact the case this year.
All right. Thank you, Mr. Chairman.
Thank you, Ms. Murray. Let me ask you about the authority over Medicare. Much of the jurisdiction rests in this committee. Under the IPAB, as you just pointed out, this process shifts the power away from members of Congress representing their constituents to determine Medicare's solvency and rates, and shifts it to either an independent bureaucracy or the Secretary of Health and Human Services. And is it true that the only way Congress can change that is to pass legislation that is also subject to a veto by the president? So, if the White House wanted unelected bureaucrats to ration the reimbursements to our local doctors or hospitals, and we chose to object to that, it could require a supermajority of the House and Senate for Congress to restore its current authority over Medicare. Is that correct?
That is correct.
So the power has been shifted from the committees and lawmakers like us who know these issues and are fighting for our patients and our providers at home. This shifts that power to either unelected bureaucrats, 15-member board, we don't know yet who they are, or some future or current Health and Human Services Secretary. And the only way we can restore our common sense alternatives is to have enough votes to overcome a super majority, a veto-proof majority. Is that correct?
That is correct.
Thank you. And when it talks about rationing care, there is no definition of ration, correct?
Correct.
So if IPAB decides they don't want to reimburse for certain procedures for our seniors, and they simply say to doctors, we will not pay you for that procedure, or we'll pay you a pittance, in effect, telling them not to do that, that's not defined. That is rationing care through reimbursements, but none of that's defined, correct?
Correct.
So in this legislation, when you say you can't ration care because they didn't define it, they do allow rationing the reimbursements so our local providers can actually treat the Medicare seniors who are sitting in their offices in front of them. Is that correct?
That is correct.
And in the 4 times we have passed this bipartisan bill where leaders like Democrat Dr. Ruiz has made the case this threatens health care for our patients and for Medicare. This is the 4th time we've passed it from this committee exactly in this process. Is that correct?
That's correct.
Right. Thank you. Ms. Murray, is there anyone else wish to amendment in the nature of substitute? Does anyone wish to
Mr.
strike the
Chairman?
last word?
Mr. Chairman?
Yes, sir.
Can you walk us through what happens if we don't have a mechanism and if Congress is derelict, hard to imagine, but if we were, what happens to Medicare recipients when what happens to Medicare recipients when the money's not there?
I apologize. You're still in questions. So the question is, what happens if we don't have IPAB?
No. What happens if this legislation is enacted and there is no mechanism to encourage Congress to be responsible and do its job? What happens to the beneficiaries when the money does not meet the projected requirements?
The question is outside of the scope of the legislation in front of us as to what may happen in future Congresses or may happen.
No, I want to know under current law what happens under Medicaid payments if the money isn't in the trust fund.
If there is not enough money in the Medicare trust fund, then you would either have to raise taxes or reduce benefits in order to ensure Medicare was solvent.
But absent Congress action, the payments are reduced on a per capita percentage basis, are they not?
If I may, Mr. Blumenauer, perhaps we could focus, Ms. Murray, on the issues of this legislation.
Mr. Chairman.
And the amendment, the nature of a substitute.
Mr. Chairman, this, I think, in my mind, goes to the heart of this. The IPAB was a mechanism to try to make sure that Congress does its job. There are some of you that voted for the balanced budget agreement of 1997, which had a mechanism to try and force Congress to do its job. You recall the Sustainable Growth, SGR. And Congress looked at these significant cuts to providers for years and kind of watched the accumulated problem grow and grow and grow until finally our leaders in both parties had a glass of lemonade and just finally decided to wipe the slate clean because Congress was not willing to have it bite, but Congress didn't step up to do its job. And we had that hanging over us, and it put people in the healthcare arena running in circles for years. The IPAB
does the same thing.
As Mr. Kind presented, is an attempt. It's not something that Congress sort of surrenders control. There is an opportunity for Congress to do its job. But despite the fact that so many of my friends on the other side of the dais have embraced unnamed cuts in Medicare and Medicaid, and have campaigned on getting this spending under control, and it's not sustainable. This was a relatively, and we've seen budgets that have been produced by our good friend Paul Ryan that were introduced with all sorts of charts and graphs that were not on a sustainable rate, and it's going to collapse, and we're going to run out of money. But the IPAB was a relatively modest effort to have unelected bureaucrats, well, any group of advisors that we have, and there are thousands of groups that we have impaneled to exercise authority, advisory or otherwise, base closing commissions. But the core here was trying to hold Congress' feet to the flames. Now, thanks to the Affordable Care Act and a number of things, we're not, we've actually extended the life. We've, as Mr. Kind pointed out, the payment, the outlays going at the lowest rate, we think, in history, darn close to it. We'll look forward to having it verified. So this thing is off into the horizon. But it just strikes me as ironic that something that's not going to happen for years and is here only to assure that Congress does its job so that we don't get in a situation like we've been in the past where we run out of money. I think it's a little overwrought and
Thank you.
conflicts.
Gentlemen's time has expired. Does anyone wish to strike the last word? Thank you. Mr. Levin, you're recognized.
I just want to point out, I think, the inconsistency of how you're approaching these issues. You're saying that Congress should act. When it comes to trying to support the insurance market, the private insurance market, so far you've essentially said, leave it up to the executive.
Do that very well, but it just,
Whether they'll continue the cost sharing, leave it to the executive.
they've done it before.
And we've urged you, through a letter from all of us on the Democratic side, to let us sit down on the full committee or the subcommittee level and work on these issues. And so I would really urge you, Mr. Chairman, to be consistent and to do as the Senate is doing on a bipartisan basis. And let us sit down in the weeks ahead and look at these issues. And so we await your answer, but I hope it's consistent with your discussion about the importance of the role of the House and our committee. You bet.
Mr. Pascrell, you're recognized.
Mr. Chairman, I move to strike the last word.
Sir.
While I'm a co-sponsor of this legislation, I support the repeal of the Independent Payment Advisory Board. I'm very disappointed that we are here today to mark up one of the least timely agenda items we have on our to-do list. We have lost, we have a host of Medicare extenders that expired last week, Mr. Chairman, a host of them, and you know it better than I do. Another host of the extenders that will expire in the coming months. I don't think these could be dismissed. Impending cuts to Medicaid's dish, they're there, they're coming. And an urgent public health crisis in Puerto Rico. On September the 19th, then HHS Secretary Price declared a public health emergency in Puerto Rico and the U.S. Virgin Islands. 95% of Puerto Rico is still without power, and according to the Federal Emergency Management Administration, 58 of Puerto Rico's 68 hospitals are without power or fuel for their generators. 1.5 million people do not have access to clean drinking water. What would that mean if we said 1.5 million Texans couldn't get drinking water? I'm ashamed by the muted political and public response to this disaster, but as someone who has been fighting for years to ensure that Puerto Ricans receive equal treatment as U.S. citizens, I am sadly not surprised. That unequal treatment, Mr. Chairman, is not rectified, and it is going to make responding to this catastrophe even more challenging. For example, Puerto Rico's Medicaid program receives far less federal funding than the states and D.C. in the form of lower match, in addition to having their total federal allotment capped. We could be talking about Texas. The fig leaf being offered by the Energy and Commerce Committee, Republicans, of a temporary fix doesn't even come close to addressing the problem and ignores it totally in the Virgin Islands. Additionally, Puerto Ricans are not eligible for the Earned Income Tax Credit, and they must have at least 3 children in order to be eligible for the Child Tax Credit. These are facts, not fiction, not fake news. I'm not making it up. To help the economy recover and provide the tools families need to lift themselves out of poverty, I am reintroducing legislation to extend these important income supports to Puerto Rico, and I'm sure most of you on both sides of the aisle will be on it. Or maybe I'm mistaken. Access to the EITC would strengthen Puerto Rico's economy, workforce participation, and tax compliance. Now, given that this bill is in the Ways and Means Committee jurisdiction, I would urge the chairman to schedule a markup of it. Additionally, since 2012, Congressman Reed and I have had a bill to make important disaster tax provisions permanent, which would take politics out of the equation when it comes to disaster relief. This approach would prevent Congress from picking and choosing which of our constituents receive tax relief after a major disaster, which is exactly what happened last week. Nowhere have I seen any comment from any legislator to say that regardless, we're going to determine whether you're deserving depending on where you live and what part of this great country you live in. I would also make note of a report in USA Today that highlights that the disaster tax provisions that passed last week for Hurricanes Harvey, Irma, and Maria would be eliminated under the Republicans' tax reform framework. The Reed-Pascrell bill has been pending before this committee for years with no action. So I'd urge the chairman to consider it. We are not, and there are no second-class citizens in the United States, and they certainly aren't any in New Jersey, New York, and Connecticut. There are two ways about it. The federal response of Puerto Rico has been unacceptably slow. In addition to the president's tone-deaf visit to the island yesterday, the administration initially denied Puerto Rico's request for a waiver for supplemental nutrition assistance
All
program.
time has expired. Mr. Paulson, you're
I'm
recognized
sure it
to
has.
strike the last word.
Strike the last word, Mr. Chairman.
Yes, sir.
Thank you, Mr. Chairman, for organizing today's markup to discuss a bipartisan and bicameral solution to a problem that was created by Obamacare. Look, we have a bill with 264 co-sponsors, a bill we have acted on in this committee several times and passed it before with bipartisan support. I expect we're going to have bipartisan support once again today. And I hope, Mr. Chairman, that we can continue discussing other bipartisan solutions to problems that we've seen with Obamacare, including the medical device tax. We know the medical device tax has been inhibiting innovation, decreasing access to life-saving medical equipment for patients, whether they're young, they're old, they're rich, or they're poor. And on a bipartisan basis, we overwhelmingly passed and supported a 2-year suspension of this tax just back in 2015. It was a tremendous boost for innovation, for patient care, and for job creation. And that's because there was wide recognition that after we lost 28,000 jobs across the country in this industry, that this was a tax on innovation that was bad policy, lost high-paying, quality jobs. Now we need to take action, and unless we do, on January 1st of 2018, this tax will blink back on because of a temporary suspension. And then again, we're going to see fewer jobs, less innovation, and ultimately, that's less help for patients. So I hope that we'll continue this process of bipartisan support, working across the aisle on that issue as well, Mr. Chairman. Looking forward, and I yield back.
Thank you, Mr. Paulson. We have a number of Democrats who've raised their hand, so let's go in order of seniority. Mr. Doggett, you're recognized.
Thank you very much, Mr. Chairman. I must say that I marvel at your interest stated in your opening statement about transparency, because seldom do we see any transparency in the operation of this committee. Rather, we operate on the principle of surprise and ambush, jack-in-the-box on these proposals. I marvel at your interest stated today about increasing access, since the only major piece of legislation this committee has considered denied access to literally millions of people. And in its various iterations, I think it was not only the vote of Senators McCain and Senators Collins and others to stop this horrid proposal that originated in this committee, but it was the fact that millions of people across America spoke out and expressed their concern about the impact on their family and their neighbor and their coworker and their church member, and they spoke out unceasingly and must continue to do so, because health care access, of which you speak, hangs by a slender thread still and is subject to sabotage efforts such as shortening the enrollment period and deciding to do maintenance on the system in the middle of the enrollment period and take money that was appropriated to navigate and encourage enrollment and instead use it to attack the Affordable Care Act. And that's not the only danger that we face today, because we've gone into a new fiscal year with Republicans leaving 400,000 Texas children who rely on the Children's Health Insurance Program at risk, with a committee meeting as we meet, considering a matter within the exclusive jurisdiction of this committee to fund any continuation of protection for those children by raising premiums on Medicare recipients. We enter this fiscal year with our community health centers left in uncertainty, and as Mr. Pascrell noted, without responding with additional Medicaid funding for the catastrophe in Puerto Rico and refusing to act to protect our safety net hospitals. So I marvel at all of those problems, but I have an even greater concern, Mr. Chairman, and that is your statement that you intend to mark up the Republican tax break bill this month. Instead of expending $17.5 billion on something that will offer absolutely no benefit of any kind to anyone in the next 3 or 4 years, provider or consumer, we ought to be considering what might happen within the next 4 weeks. And that 4-week period is something in which apparently there'll be little transparency in considering a gigantic tax break proposal. I am concerned that we need a series of hearings instead of expending our time on this type of matter to explore the proposed tax changes and their impact on the middle class and on working families across this country, as well as apparently well over $2 trillion that will be added to our national debt, despite claims initially repeated in this committee that this will all be paid for. At least the Senate, which certainly hasn't explored this matter thoroughly itself, has begun hearings here as recently as yesterday. But this committee has done nothing concerning that tax bill in public during the month of September. We haven't heard of a single hearing scheduled for the month of October, but we have heard that that bill will be marked up, perhaps having learned little from the health care fiasco, in the same manner. Last minute, jack in the box, with no administration official having the courage to come before this committee and defend a proposal which they say is all about the middle class, but appears to be aimed solely at those at the very top. The one report we do have, not from the staff of this committee, but from an outside objective source, is that the top 1% gets a $129,000 tax cut every year, and those who are working up to about $86,000 of income will get a mere $55 a month. That's the type of slanted, unfair tax proposal that needs to be examined thoroughly, rather than jumping out of the box as a last-minute proposal and foisted off on the American people in much the same way that the failed health care bill was done. I yield back.
Mr. Corbello, you recognize to strike the last word.
Mr. Chairman, is this normal? I'm still kind of new to this committee, and I understand that Republicans and Democrats have plenty of disagreements with regards to the ACA, but I think there are some areas of agreement. I think even our Democratic colleagues have recognized some of the flaws in the legislation, and here we have an opportunity to work together to address one of those. And a lot of my Democratic colleagues are on the record as supporting this provision, yet we hear every reason why today isn't the right time. There's always a good excuse to postpone bipartisanship, and I just don't understand that. There's a lot of common ground that we can find, whether it's IPAB, whether it's cost-sharing reductions, which, by the way, a lot of Republicans support. The chairman has spoken about the need to address this, definitely in the short term. And it's just a true shame. And I do appreciate my colleague bringing up Puerto Rico. It's personal for me. My wife still has family there. Her 2 brothers were born there. And last week we had an opportunity to work together for Puerto Rico, for U.S. Virgin Islands, Florida, Texas, Louisiana. And yet a lot of colleagues went to the floor and again said that it just wasn't the right time and it just wasn't enough. Well, here's what I'll say. I'm willing to work with any colleague on this committee who wants to help the people of Puerto Rico, because they really need it. And again, for me, it's personal. It hits home. But I think we should also work with the resident commissioner of Puerto Rico. Jennifer Gonzalez Colon was the candidate who received the most votes on the island last election. And a lot of my colleagues decided to ignore her last week when she was calling for passage of the tax relief bill. That seems cynical to me. It seems wrong. So, sure, let's work together. I'm all in. But let's not just say it. Let's do it. And I think when it comes to Puerto Rico, we certainly should. And when it comes to where we agree on the ACA, we certainly should. Why do we always have to highlight what divides us? For once, let's focus on what brings us together. And this IPAB issue has brought a lot of Republicans and Democrats together for years now. So let's put the politics aside and let's get it done. I yield back.
Mr. Thompson, you recognize strike the last word.
Thank you, Mr. Chairman. You know, the health care reforms that we were able to accomplish in the Affordable Care Act proved to be a true success for seniors. Closing the prescription drug donut hole saved over 400,000 Californians over $400 million on their drug cost in 2015. That's about an average of over $1,000 per person. In 2015 alone, almost 40 million seniors have taken advantage of the new Medicare benefit that provides coverage of key preventive services with no copay and no deductible. It's also been successful in bending the healthcare cost curve. Healthcare costs have grown at the slowest rate in over 50 years. And this applies to Medicare too. Due to slower cost growth, Medicare spent $473 billion less from 2009 through 2014 than it would have if the pre-ACA spending trends had continued. And because Medicare isn't seeing unsustainable cost increase, in other words, because the law is working, IPAB, as we heard from Ms. Murray, hasn't been triggered. And it won't be triggered during the next 2 years. So the $17.5 billion that's going to be spent provides no benefit to anyone. You know, I don't like the IPAB. I've said that from this dais before. We were all elected to be representatives for our district. Every one of us, both sides of the aisle, worked really hard to get on this committee. And we didn't do it so we could relinquish our responsibilities to some commission someplace else. And in the past, I've voted for this. And when I did, I stated at the time, I'll wait and see when it comes to the floor how it's going to be paid for. And what happened? It gets to the floor and you start robbing Peter to pay Paul. Sadly, I had to vote against it. Well, I'm going to change course today. Mr. Chairman, I'm going to vote against this in the committee and wait to see what you do when it gets to the floor. And if you pay for it, and you pay for it without stealing from seniors or the children, then I'll vote for it. I yield back the balance of my time.
Ms. Wolorsky, you recognize strike the last word.
Thank you, Mr. Chairman. I want to associate myself with Mr. Paulson's remarks on the job-killing medical device tax. We need to repeal this tax before it restarts in January. This tax harms patients' access to the newest and best medical devices, stifles innovation, and hurts economic growth, including in my home state of Indiana, which is home to over 300 medical device companies that employ thousands in good-paying jobs. Repealing this harmful tax has broad bipartisan support. I also hope our committee will consider another bipartisan piece of legislation, my bill H.R. 3798, the Save American Workers Act. This bill would repeal Obamacare's definition of full-time work as 30 hours per week. This is another job-killing piece of legislation that Obamacare has forced businesses to reduce hours or slow hiring in order to avoid triggering unaffordable new costs or substantial fines. This misguided policy has affected workers both in the private sector and public sector, including employees of cities, states, and schools. I hope we can work together to move this bill forward as well. Thank you, and I yield back.
Thank you, Mr. Lewis. You recognize strike the last word.
Thank you, Mr. Chairman. Mr. Chairman, the issue before us today is not a crisis. My colleagues are right in saying what is happening in Puerto Rico is a crisis. Guns are a crisis. When we see 52 members of our society killed, murdered, when we see more than 500 people shot, wounded, that is a crisis. Children's health care is a crisis. We need to do the people's work. IPAD will not trigger for 4 years. We can do better. Why we bring this issue before us today? People are crying out for help, and they need it now. When you see the President of the United States go to Puerto Rico, throwing toilet paper, paper towels, what is that saying to the American people? That is an affront, an insult. And we go on like it's usual business. We need to get out of the box and do what is right and fair and just. Some of us have been trying to get you to do something about guns. How many more bodies? How many more? Hundreds? Thousands? Millions? How many more mothers and fathers, sisters and brothers? How many more children? People afraid to go to school, afraid to go to church, to the temple, to a mosque, to a synagogue. Have we lost our way? Can we lead? Can we be headlights rather than taillights? What did we come here for? The American people are watching. Let's deal with the real issues beforehand. Are you back?
Mr. Larson, you recognize, strike the last word.
When you hear the conscience of the Congress speak, it's hard to follow the words of an iconic leader of our country. I can only underscore the incredible disappointment. Our colleague from Florida, who is incredibly sincere in his actions, and when I've heard him speak on the floor and in this committee, and he said, always a good excuse. What excuse is there for letting children's health care expire and not take it up? What excuse is there for community health centers to expire and not take it up? There was no one on this committee, I'll venture to say, who when they left home this week that their constituents said, boy, I hope you tackle that iPad problem. I hope you guys get right on that thing, because that's the most important thing that's going on in the country today. Children's health expired. There is no fierce urgency of now in this Congress, and that is what frustrates this side of the aisle. The gentleman from Florida is right. There is a lot of, as is the gentleman from Minnesota, there's a lot of bipartisan agreement. Where is the agreement on the urgency of now for children? You all have community hospitals. They expired on the 30th. That expired. And we're talking about IPAB? People in my district are saying, give me a break. Will Congress do something? Will they act in a manner that impacts our daily lives? I want to associate myself with the eloquence of Mr. Pasquale on the plight of Puerto Rico and the Virgin Islands. The fierce urgency of now demands the vitality of all of our ideas and the compassion in which we know resides in every member of this committee to act on behalf of our children, of our families, of our fellow American citizens who need our help, who turn to what was once the great beacon of help, the place where they send their representatives to assist and help them through the struggles of their everyday concerns. The fierce urgency of now is upon us. Come on. I reserve.
Mr. Reed, you recognize strike the last word.
Thank you, Mr. Chairman. Mr. Chairman, I thank you for the opportunity to discuss an issue that is not only essential to many rural hospitals in New York's 23rd District, but to the nearly 60 million Americans living in rural communities across the country. Rural hospitals have unique challenges, Mr. Chairman. They often have limited workforce options, physician shortages, difficult patient mix, and razor-tight budgets. This can make it rough for rural hospitals to keep their doors open. That is why earlier this year I introduced H.R. 1955, the Rural Hospital Access Act of 2017, with my colleague Representative Peter Welch from Vermont. This bipartisan bill would extend the Medicare-dependent hospital and low-volume hospital programs on a long-term basis, ensuring Americans living in rural areas have access to care. Back home, we have 7 rural hospitals that benefit from these programs and keep their doors open. As you're aware, Mr. Chairman, these 2 rural hospital-focused programs expired 4 days ago. I would like to urge this body to pass an extension of the Medicare-dependent hospital and low-volume hospital programs, along with the reauthorization of the Children's Health Insurance Program, reauthorization, and IPAB repeal. We must pass an extension of these programs so that patients do not suffer the potential consequences of cutbacks on services, or even worse, hospital shutdowns in our rural communities. Thank you, Mr. Chairman. I yield back the balance of my time.
So will the gentleman yield for a moment?
I would love to yield to you, Mr. Chairman.
Mr. Reed, you raised a great point. The committee has already marked up 2 extender bills before today. The staff is discussing additional Medicare extenders with their Democratic colleagues, both here and on Energy and Commerce. We'll pursue regular order on such extenders when a bipartisan agreement is reached. We were hopeful when we began discussions weeks ago, perhaps we could come together on a bipartisan package ahead of the date on children's health insurance. I'm still hopeful that that can occur before these issues move to the floor. And in the meantime, Energy and Commerce Committee today is moving on extension of the Children's Health Insurance Program. I think there's common ground here to be found, and we'll continue to work toward it.
Well, reclaiming my time, and I thank you for that, Mr. Chairman, and I appreciate the consideration. With that, I yield back.
Thank you. Mr. Kind, you're recognized. Strike the last word.
Thank you, Mr. Chairman. Mr. Chairman, I'll be brief, but just so I'm clear, we've got legislation pending before us today that calls for the repeal of a non-existent commission based on a non-existent growth rate, based on non-existent rationing recommendations, based on non-existent health care costs, cuts, based on a non-existent tax increase for premium increases. And the earliest that it can be triggered, that Ms. Murray just testified again today, is 2022, over 5 years from now. I really thought we had more courage in this committee than what we're exhibiting today. I get the feeling that many of my colleagues need a nightlight in order to sleep comfortably at night, in order to combat non-existent monsters that might be lurking in the shadows. And the only reason anyone would support this legislation or the repeal of IPAB is to admit to ourselves that Congress is incapable of doing our job. Because again, as Ms. Murray testified today, There is nothing that prevents Congress from being able to intervene and stop the IPAB process off, to reject any recommendations on growth rates, if we just get together and do our own job in order to bring down health care costs to make it more affordable for all Americans. That's what the legislation calls for, and that's the reason why IPAB was put into the Affordable Care Act to begin with. It was another cost containment measure amongst many to deliver better outcomes at a better price. From accountable care organizations to medical homes to bundling to the Center on Innovation that's working on alternative payment models. 40% of all Medicare payments this year, because of the Affordable Care Act, will be based on quality and value and outcome, moving away from fee-for-service, volume-based reimbursement. These are all good things. And yet so many of you have been hell-bent in repealing it all for political reasons. What we need to start recognizing as a nation and this Congress is there are things that are working within the healthcare system, and God forbid within the Affordable Care Act or Obamacare, that we ought not change. And there are things that clearly need to be fixed. And hopefully we can do that in a bipartisan fashion. But one thing that we all need to stay focused on is what we can do together to reduce health care costs to make it more affordable for all Americans. You know, I agree with my friend from Minnesota, Mr. Paulson. I'm the lead Democratic sponsor on the repeal of the medical device tax because I'm afraid of what that's doing in regards to investment and innovation in a vitally important industry in the healthcare sector. And that's going to expire by early next year. There is nothing that prohibits this committee from bringing up legislation today, calling for the repeal of medical device tax and working together to find an acceptable offset or pay for within the healthcare system, so we're not just adding it to the national debt. Nothing's preventing us from doing it. We've had member after member talk about today things that are expiring that require our attention today, not 5 years from now, including rural hospitals. And I have many in my district, Mr. Reed, in western Wisconsin, and I share your concerns, and I'm with you on that. That's something that we can be or should be addressing today. But one of the great hesitations that we have on our side is a $17.5 billion cost that didn't exist before August 15th if we had done a resolution in Congress, but does exist today, and where the pay-fors are going to come to offset that, assuming that by the time this legislation comes to the floor that there will be pay-fors. And if the Children's Health Insurance Program is any indication, we got an inkling that the pay-fors are going to come right out of the Affordable Care Act, just as the CHIP program is today. And that's going to be a problem, especially for many of my colleagues on this side who's supporting repeal of IPAB. But we're getting into this habit of hiding the ball in this committee way too much. We're bringing forward legislation that has a direct budgetary impact and not saying how we're going to pay for it and waiting till the very last minute and springing it upon members on the House floor for them to consider then. And we ought to be a little more upfront, I think, and working hard to find pay-fors, discussing those pay-fors before they even have a chance of going to the floor to see if there is an opportunity for bipartisan cooperation. And if your budget that you're about to vote for this week is any indication, too, we have another inkling where the pay-fors are going to come from. $487 billion worth of cuts to Medicare over the next 10 years is what your budget calls for, that we're about to vote on either tomorrow or sometime this evening. $487 billion in cuts to Medicare. And you guys are worried about potential cuts that might transpire from a commission that doesn't exist within 5 years?
Time has expired. Mr. Colley, you are
back.
recognized. Strike the last word.
Mr. Chairman, did you recognize me? I'm sorry, thank you. Mr. Chairman, where to begin? I do think, and I appreciate the efforts towards bipartisanship, and listen to the words of Mr. Corbello in particular. But I, quite frankly, have to say, I think this is a charade. This bill is masquerading as a movement towards bipartisanship. And we all know, and Mr. Chairman, you know personally, there's very little, if any, bipartisanship going on in this committee. There is some between members themselves, and I appreciate Mr. Paulson and others, and Peter Roskam and I have done some bills together. A number of us, Mr. Paulson and I have done some bills together.
Will the gentleman yield?
Not at this moment. I will momentarily, though. And a number of us have worked on some bipartisan bills, and it's good to hear Mr. Reed talk about the problems facing rural hospitals in my home state of New York. I think that's also facing states all around the country. There are very pressing issues that are confronting this Congress. I don't believe that IPAB is one of them at this point in time. It's an issue that's down the road is going to be something that we'll have to address possibly, but right now isn't the moment in time. So I do think that there is a great deal of effort to put a spin on this that somehow we're missing an opportunity for bipartisanship. I haven't seen 1 ounce of bipartisanship often on one of the biggest issues that this committee is going to have to tackle, and that is tax reform. Meetings have gone on, and there was a meeting last week that Democrats once again weren't invited to, and somehow there's going to be, some light from heaven that's going to all of a sudden shine upon us, and it's going to be bipartisanship again. And we've heard the majority tell us that they intend to use reconciliation when it comes to this bill, so as to minimize the role of the minority in the Senate and their ability to make substantial changes down the road or have input when it comes to the issue of tax reform. So there's really very little bipartisanship going on, and there's so many crises that we're being confronted with daily. We know our friends in Puerto Rico, and my thoughts and prayers are with Mr. Corbello and his family, his wife's family. I have a substantial number of constituents who have yet to be able to communicate with their loved ones back home in Puerto Rico and the Virgin Islands. There's 3.6 million folks there who are suffering right now as we're dealing with this IPAB bill. They can't wait for us to get done with this IPAB bill. They really can't. They can't wait for us to get rid of it, so they maybe focus on them a little bit more. The child health care program, CHIPS in my state, affects 9 million children nationwide. This issue of IPAB is more important than dealing with the issue of the CHIPS program, so we'll write that one down as well. Dish payments, $329 million in critical care cuts alone just for next year. In a city like mine, and I would also dare to say in Mr. Reed's district as well, this will have an effect on his district in upstate New York. 1,400 community health centers. We didn't take up their renewal. Let that expire. Special diabetes programs, childhood obesity demonstration projects, National Health Service Corps, just to name a few issues that we're not taking up because we have to deal with IPAB that is not set to go into effect for another 4 years because it's so critical and so crucial to special interest, to the American people, that we have to deal with it right now. It's more than disappointing, and I agree, Mr. Corbello, that there isn't more bipartisanship, but we'd like to do more things in a bipartisan way, but we're not in control. We don't control the agenda. We don't control what comes before this committee. We don't control the hearing process, so what bills are brought up, like this bill, whether we have another hearing before we bring it to the committee for a markup, full committee. So we don't control a lot of things around here. And yet we hear the call for bipartisanship from the other side of the aisle. When you control bipartisanship, you determine whether we're going to be bipartisan or not. And this is the bill you chose to be bipartisan on. It is a masquerade. It is a cover-up. And yes, I will yield to the gentleman.
I would like to point out that last week we had a bill on the floor. 3 Democratic amendments were offered, ruled in order, and accepted on the floor. The sponsors of all those amendments voted no on the bill. The bill was paid for, and there were some other reasons for voting no, and I hope that everything is sincere there.
Reclaiming my time, let me just mention to the gentleman that we all know what was woefully lacking in that bill. Let me do this. Wow, bipartisanship. That's your example of bipartisanship, bringing a bill to the floor.
Gentleman's time has
suspension
expired.
Without debate.
Gentleman's
real
time
debate.
has expired. Mr.
Real debate.
Crowley.
Big deal.
The gentleman's time has expired.
We know what was lacking in that bill.
Mr. Crowley. Dr. Davis, you're recognized. Strike the last word.
Thank you, Mr. Chairman. You know, as I listen to this discussion, I think that I'm always concerned about advisory committees unless there is a way to make sure that they are, in fact, accountable. And I think one of the problems with this committee is that it has enormous power, but there is no way to assure that its decisions are going to be accountable, and if so, to whom? I also want to associate myself with many of the comments that have been made by members on both sides of the aisle. Those who have expressed desire to deal with the immediacy of crisis situations that face our nation. Obviously, the hurricanes, the rains, the storms, the flooding, Texas, Virgin Islands, Puerto Rico, all across the nation have gripped the thoughts and ideas of our citizenry. Individuals are paralyzed almost from what they have been watching on television the last few days relative to the massacre in Nevada. And yes, we are discussing an issue that may not and does not have the full impact or the immediacy of wondering whether or not children are going to be able to go to see the doctor. The mothers whose children will have a fever or they don't know what to do, and the Children's Health Insurance Program has not been reauthorized and funded. Community health centers that Mr. Crowley talked about all across the country, those last possibilities of health care for millions of individuals, we have not reauthorized. We need to make sure that there is, in fact, bipartisanship as we not only reauthorize but fully fund these programs that have meant so much and continue to mean so much. As far as the iPad, well, it's an issue, but it certainly is not a priority. And so, Mr. Chairman, I would simply urge us to move ahead, bring up those priority concerns, and give all of us the opportunity to display the bipartisanship that we've heard so much about this morning. I thank you and yield back the balance of my time.
Thank you, Dr. Davis. Ms. Sanchez, you're recognized. Strike the last word.
Thank you, Mr. Chairman. I agree with my colleagues that this body has a number of urgent, pressing issues that we cannot ignore, that we must address, and whether that's funding for community health centers, aid for Puerto Rico as families there rebuild from the hurricane, and delaying cuts to hospitals that serve some of our most vulnerable. Those are all urgent, pressing issues that deserve our attention. Not to mention, this committee in particular should be engaging in a real bipartisan effort on tax reform. Not one side locked in a room writing a bill, but real engagement with the Democratic members on this side. The Independent Payment Advisory Board isn't projected to be triggered for several years, and so I agree wholeheartedly with my Democratic colleagues and their criticism that we should be dealing with more urgent, pressing issues at this time. Although IPAD is not one of our most pressing matters, repealing the IPAD is sound public policy. As my colleagues on this committee well know, I've long supported the Affordable Care Act. I proudly voted for the bill and championed the gender rating provision to ensure that women would no longer be charged more for coverage than men simply because of their gender. And I recognize what the Affordable Care Act has done. It's been transformative for millions of working families. Thanks to the Affordable Care Act, 20 million Americans have gained coverage. Thanks to the Affordable Care Act, people can no longer be discriminated against for having pre-existing conditions like Alzheimer's, cancer, kidney disease, asthma, diabetes. And thanks to the Affordable Care Act, American families no longer face annual or lifetime caps on coverage, limiting their access to life-saving care precisely when they need it the most. At the same time, I've always said that the ACA is not perfect, and there's certainly more that we can and must do to build on the law's progress and make changes to the law where necessary and appropriate. That's why I have supported in the past and even led the effort at one point to repeal the IPAB. I remain concerned that the IPAB, an unelected board with the power to cut Medicare spending, would operate largely without congressional oversight or approval. As members of Congress, we are accountable for our decisions with our constituents back home, and rightly so. I can't in good faith give an unaccountable board the authority to make such potentially sweeping changes to Medicare, a vital program on which millions of older adults rely for their health care. I appreciate the opportunity to work together to build on and improve the Affordable Care Act, and I hope that this won't be the last time my Republican colleagues decide to work with Democrats to improve what needs fixing in the ACA, rather than repeated attempts to repeal or to sabotage the ACA. And with that, I yield back, Mr. Chairman.
Ms. Sewell, you're recognized. Strike the last word.
Thank you, Mr. Chairman. With all due respect, what are we doing here today? In my district and in rural America across this nation, our healthcare providers and our hospitals are on life support. But instead of doing everything we can to keep their doors open, Congress this weekend allowed two programs, CHIP, the Children's Health Insurance Program, and DISH, which ensure their solvency, to expire. While IPAB will not be triggered until 2021, the low-volume adjustment, community health center funding, and CHIP funding expired last week. Congress also failed to delay DISH cuts, which will impact hospitals this year, right now. Last month, Mr. Chairman, I had an opportunity to visit a hospital in my district, J. Paul Jones Hospital in Camden, Alabama, that is on the brink of closure. We're working to find creative and innovative solutions through community partnerships to keep their doors open. Regardless, the hospital continues to operate week to week. I have two other hospitals that are also in dire condition, where doctors and nurses are working without pay, and administrators are begging local residents to vote for a sales tax increase in rural towns where sales taxes are already 10 to 15 cents on a dollar. Several essential programs for Alabama's hospitals expired last Saturday. Cuts to DISH programs went into effect, which cost Alabama hospitals $56 million in federal funding next year. The CHIP program expired, which provides health insurance to 9 million American children and 150,000 Alabama children. The low-volume adjustment, which 5 of my most vulnerable hospitals rely on, expired as well. Alabama hospitals will lose more than $56 million next year alone if the DISH payments are not delayed. In 2019, that will jump to $85 million and to $113 million in 2020. Mr. Chairman, the House is on fire, and today we're busy cutting the grass. Make no mistake, I understand concerns about IPAB, but this bill and this markup today does not even address how it will be paid for, and it will cost $17.5 billion, not an insignificant amount. I am so alarmed by the failure of Congress to extend the low-volume adjustment and delaying the DISH cuts for struggling hospitals and providers. Providers in Alabama and across this country cannot continue to cut their way to prosperity or profitability. My most immediate concern is that absent DISH payments and low-volume add-ons, larger hospital systems will decide that the loss of absorbing isn't enough to continue providing health care in Alabama, a state that continues to suffer from not expanding Medicaid. And we will lose providers and hospitals long before IPAB will ever be triggered. The emergency before us is the extenders and the programs that expired this past weekend, and the ineffectiveness of bills currently being debated in the Energy and Commerce Committee that address CHIP and DISH. While in Congress we have a responsibility to protect the solvency of Medicare, I am a firm believer that we must do so not through cuts, but through innovative approaches that increase access to preventive care and save long-term costs to the system. Yesterday, I received a note from an administrator of a large hospital in my district. While he has advocated for the IPAB repeal, as do I, he says that the issue of extenders, DISH and CHIP, are 100 times more urgent right now than IPAB. The hospital system he represents could lose more than $4.6 million in revenue next year because of the DISH cuts, and over 8 years of cuts would be as much as $99 million. Hospitals in my district and across America can't make volume appear out of thin air to make up these losses. If these cuts are not delayed, the facilities will have to make further staffing cuts, consolidations, and facility closures. Mr. Chairman, we need to extend CHIP and DISH costs today, not next week, not next month, but right now. I hope that we will shift to a bipartisan bills that expand and extend the programs our hospitals and providers rely on to care for our constituents. Let's restore the low volume adjustment, community health centers and CHIP funding, and delay DISH cuts before it's too late. I yield back my balance of my time.
Ms. Delbeni, you're recognized. Strike the last word.
Thank you, Mr. Chair. I'm disappointed that we're considering this legislation today. It's not timely, as the Independent Payment Advisory Board likely won't be triggered for 4 years, when there's so many time-sensitive issues that need our attention. The Children's Health Insurance Program, or CHIP, expired 4 days ago. That means the health and well-being of nearly 9 million children is currently hanging in the balance, including more than 65,000 in my home state of Washington. The home visiting program, teaching health centers, the National Health Service Corps have expired. We should be taking immediate action to provide states, families, and communities by reauthorizing these critical programs. At the same time, millions of our fellow Americans are struggling for survival in Puerto Rico and the Virgin Islands in the aftermath of one of the worst hurricane seasons we've seen in our lifetimes. Yet the tax provisions this chamber has approved are wholly inadequate to meet the needs of individuals and families who are suffering. We can and we must do more. 3 nights ago, our nation witnessed a horrific mass shooting. It was shocking and devastatingly tragic. But this chamber is continuing to ignore the tragic cycle of gun violence. The majority's callous refusal to allow votes, even discussion, including on bipartisan reforms, is inexcusable. And beyond these issues, there are impending deadlines that deserve our attention well before this. For example, the medical device tax, which many of my colleagues and I believe hinders job growth and innovation, is scheduled to take effect again on January 1st. We shouldn't wait till the last minute to act. Mr. Chair, I strongly believe this committee and this chamber are failing to be responsible stewards of public policy. The American people deserve better. I yield back.
Ms. Chu, you're recognized. Strike the last word.
Thank you, Mr. Chair. All year, my colleagues on the other side of the aisle continue to attack the Affordable Care Act at every turn. From hiding the bill language from members of this committee this past March, to backdoor deals and last-ditch efforts to repeal the law in the Senate, it seems that the Republicans were willing to accept any policy, no matter how harmful, if it meant they could claim that they repealed Obamacare. Now that all of these efforts have failed, they are looking for ways to chip away at any piece of the ACA. So today, we consider a bill that would repeal the Independent Payment Advisory Board, IPAB. But even though the IPAB has not even been constituted and will not be for years, repealing it now will require a pay-for of $17.5 billion. We have no idea what the pay-for could be. In fact, it could be from the community health centers. The reason I say this is that Congress did an outrageous thing this weekend and let funding for community health centers lapse. Community health centers provide essential safety net care for communities like mine in Southern California. This funding cliff represents a 70% cut in health center funding, meaning that these community-based facilities will no doubt have to shut their doors. In my district, there are 8 community clinics who serve nearly 100,000 patients, from children to the elderly. Of these patients, nearly half are uninsured, 32% do not speak English as their primary language, and 40% of these patients fall below 100% of the federal poverty line. These numbers tell a story that the community clinics in my district and districts all across the country are truly serving the most in need. Without these clinics, most of these individuals will not have any options for health care. And if something were to go wrong, they would end up in emergency rooms. But it's not just the numbers that tell the story. It's people like my constituent Matt, who is a patient at CHAP Care, one of the community clinics in my district. Matt works full-time, but his jobs primarily consist of contract work that does not provide health coverage, or because he has an existing condition, did not offer benefits that covered his treatment. For years, he went without coverage until he was enrolled in Medicaid through California's Medicaid expansion. Now, not only does he have health coverage, but he's able to access full coverage at CHAP Care. If CHAP Care were to close because Congress failed to act, people like Matt would have nowhere to go. For 50 years, Congress has supported community health centers on a bipartisan basis. Instead of spending time discussing non-pressing provisions of the Affordable Care Act, I implore my colleagues to direct their attention to the communities that demand their urgent consideration. With that, I yield back.
Mr. Neal, you recognize strike the
Thank you,
last
Mr.
word.
Chairman. I'd hope that you would consider a unanimous consent request to enter my written opening statement into the record.
Yeah, without objection.
Thank you, Mr. Chairman. Mr. Chairman, there is nobody on this dais, nor in the Democratic caucus as well, who was more in favor of getting rid of IPAB than I have been. I actually helped to succeed in keeping it out of the House version of the ACA and protested aggressively against it. But my view on it is consistent with other positions I've taken since my time in the House, and I hope my Republican colleagues can take note of the following. No reason to have a line item veto. No reason to have a balanced budget amendment to the Constitution. No reason for us to have embraced a moratorium on congressional prerogative as it relates to earmarking. That is Article 1 of the Constitution, which lists us as the first branch of government. I call that up because I think there's an effort that can be made from time to time to use the politics of the moment to end serious debate about what our positions ought to be in terms of consistency over a period of time. So I objected to the whole idea of creating IPAB in the first place and would hope that it will be eliminated. As Mr. Kine has correctly noted, this is not the moment to do that. There's really nothing to end because it's not in front of us. But the urgency of some of the other issues are, and I want to raise the issue that Mr. Corbello noted about the debate on the House floor. That was not about timing. There was broad agreement in the Democratic caucus to begin the process of getting aid to members of the Puerto Rican community and on the island of Puerto Rico. And at the same time, the question we had was whether or not it was enough. And my anticipation is that time will bear that out, but there will be an accountability process that will be involved about the measure that was taken. In addition to which, he cited the resident commissioner of Puerto Rico. Let me cite where many of us on this side took our guidance. Nydia Velázquez, born on the island of Puerto Rico. Luis Gutierrez, born on the island of Puerto Rico. Jose Serrano, born on the island of Puerto Rico. They were there in short order. They still have family and friends on that island that they could not make contact with in the immediacy of the disaster of that hurricane. So I think that as we all move to the floor to make sure that Louisiana and Texas and other affected areas had that aid immediately, The question that we had on this side was whether or not the money that was coming to Puerto Rico was adequate. And I think that in short order, we'll be able to make that determination. And with that, I yield back the balance of my time.
Thank you. Just recognize myself. I do want to thank Mr. Corbello for adding an amendment, bipartisan amendment, $200 million to help Puerto Rico with the tax provisions immediately in the Virgin Islands, to treat Puerto Rico and the Virgin Islands just as we do, providing help to Texas, Louisiana, and Florida victims. It is regrettable, for whatever excuse, that members did not support that on the House floor on Monday. I am glad that we were able to come together to provide that relief later that week. And I'm pleased that President Trump's team presented yet another relief package that will be, I think, hugely helpful to Florida and Louisiana and Texas, in Puerto Rico and Virgin Islands, and I understand that the House is going to move forward very quickly in that regard.
Mr. Chairman, would you yield for a moment?
Not at this time. Are there amendments to the amendment?
Mr. Chairman, I have an amendment.
Yep, Mr. Doggett. For what purpose does gentleman seek recognition?
I have an amendment at the desk, Mr. Chairman.
So, gentleman is recognized. Purpose to offer an amendment.
I reserve.
Mr. Reichert reserves a point of order, and I ask gentlemen to suspend while the clerk distributes.
Thank you.
Okay. Great. Gentleman is recognized for purposes of offering his amendment.
Thank you very much, Mr. Chairman. Last week, Tuesday to be precise, President Trump was with several of us in the Roosevelt Room at the White House, and he declared that this tax cut that he was proposing was not for the rich, that it was all for the middle class. And he said that not once, but several times. The next day, he said, quote, "I don't benefit. I don't benefit. In fact, very, very strongly, as you see, I think there's very little benefit for people of wealth," end quote. This amendment is a truth test amendment to determine whether those statements, which appear to me to be false and misleading, are in fact truthful. As with the health care claims, that we would suddenly have a healthcare system that would cover everyone and would provide better coverage and less expensive coverage, reality did not comport with the claims that were made. And I think that the tax cut proposal, as best we can determine, appears to not be any of the things that President Trump says are in it. This is particularly important with regard to whether the President of the United States benefits personally from this tax cut proposal, and whether it is about enriching America and American jobs and the American economy, or is about simply enriching him and his family. Before we consider even a penny worth of tax breaks for the wealthiest few in this country, I think the American people have a right to know about whether the plan is about self-enrichment or about gains for our entire country. If you're a middle-class family, we learned only within the last several days that one of the principal authors who was with us last week at the White House meeting has said that he, quote, "cannot guarantee that taxes will not be increased for middle-class families. The guaranteed tax breaks are reserved for the top 1% and large multinationals, including Mr. Trump." Now, because we do not have the Trump tax returns that he promised at one point he would provide, and we do not have the documents concerning the operations of his many businesses, we have only the analysis today from the New York Times, which found that Mr. Trump could save more than $1 billion himself under his tax plan. The Times based that analysis in large measure on only 2 pages of Trump tax returns that were disclosed from several years ago. Never before in the history of this country has a president of the United States stood to gain so much personally from something that he has proposed. We don't know whether the benefit that he will get will be bigly or just huge until we end the cover-up of the tax returns. This tax plan offers only limited clues, but repealing the tax on estates, which currently applies to only 2 out of every 1,000 estates, would appear by itself to provide over $1 billion for the Trump family. Nixing the alternative minimum tax meant to make sure that even the wealthiest few with the cleverest accountants have to pay at least something for our national security would be a windfall for Mr. Trump. We know from his 2005 return that had it not been for the alternative minimum tax, he would have actually paid a tax rate of a little over 3%, akin to what is paid by the poorest half of Americans, and that he would have saved by this provision alone about $30 million. Then there's a loophole that is tailor-made for Mr. Trump, that is the pass-through provision, which appears to be helping small business, but is actually designed to help those at the top. So this amendment provides in full that the IPAB would not be repealed until we have the documents that some of us have been seeking for some time concerning Mr. Trump's returns, so that we can determine, is the benefit for him or is the benefit for America? Are the claims that he will not benefit at all true, or are they false as the data would appear to indicate? In addition, we have the concern about over $2 trillion added to our national debt. All matters that justify approval of this amendment.
All time has expired. Mr. Reich, you recognized?
Mr. Chairman, I make a point of order to the amendment because it's not germane to the amendment in the nature of a substitute. The amendment violates House Rule 16, Clause 7, because it makes the bill dependent on an unrelated contingency, clearly a different subject matter.
Thank you. Does the gentleman offering the amendment wish to speak on the point of order?
Chairman, I do wish to speak on the amendment. I think it is time to end the cover-up that has occurred here, and I would yield to my colleague, Mr. Pascrell, who has some other observations about why this amendment is appropriate. All we're saying is don't enact this repeal until such time as we have these documents. It goes directly to the effective date of this legislation, so I believe it's very germane. I yield to Mr. Pascrell.
Mr. Chairman?
You recognize Mr. Pascal.
Thank you very much. I think that this is a reasonable amendment, and I think it's a reasonable request. Breaking with 40 years of precedent, the President refused to release his returns as a candidate and now as the President of the United States. The committee has the authority under IRC 6103, I've referenced it many, many times, to obtain the President's tax returns for review. The New York Times has estimated that the President of the United States and his family would personally benefit by more than $1 billion, mostly due to repeal of the estate tax, which would benefit extremely wealthy heirs like his sons and daughters. By the way, this estate tax affects 0.5% of our population, yet we've made some people on this committee and made people think they're going to get a windfall. And they're not going to get anything. The repeal of the alternative minimum tax would also allow him to keep $28 million more in 1 year based upon the skimpy returns that we had on the 2-page document in 2005. But a portion of cash would come from the lower pass-through rate of 25%. Since all of his businesses are pass-throughs, all of his businesses. His personal income, and by the way, he did not divest, that was asked by the ethics chairman. His personal income would be taxed at this lower rate versus a top individual rate of 35% in the proposal. But this is just a rough estimate. We need to see his full 10,000-page tax return to understand how he stands to benefit. The Attorney General of New York is working on this. Mr. Mueller is working on this. We should be working on this, Mr. Chairman. The American public deserves to know whether the President is pushing for tax changes to best personally benefit himself and his family. So I urge support for Mr. Doggett's amendment, and I yield back to Mr. Doggett.
Mr. Chairman, we have, in directing my remarks to the germaneness question, we've tried in a number of ways to get these returns evaluated by our staff and to determine if they should then be made public. Much of that discussion has focused on Mr. Trump's entanglement with Russians and Russian operations. That is still a very valid concern. But today, my focus is on our responsibilities as tax writers, aware that you plan to bring up a major tax bill within a month, that we have the President's declaration that he's not benefiting personally, and offering this amendment as an amendment to the effective date for this legislation as a way of getting the committee to do its job, stop covering up the Trump tax returns, study and evaluate them, and see with a truth test, do they match up to the President's claims and the claims of others. I believe it is a very germane way of addressing this problem, and I would urge rejection of the point of order and an opportunity for the committee to vote up and down on whether these tax returns should be supplied to the committee pursuant to our longstanding legislative authority to secure those returns, and I yield back.
Thank you, Mr. Doggett. I am prepared to rule the amendment is not germane. The amendment in nature substitute because it violates House Rule 16, Clause 7 by making the bill contingent on something unrelated to the bill we are considering.
Mr. Chairman, on
order is sustained. The amendment is not in order.
And on that, I would respectfully challenge the rule of the chair.
Mr. Reichert.
Mr. Chairman, I move to table the appeal.
Questions on the motion to table the appeal. The chair's ruling. All those in favor signify by saying aye. Aye. Those opposed, no.
No.
Give me the chair. The ayes have it. The motion to table is agreed to. Yes, a roll call is requested. The clerk will report the vote.
Mr. Johnson? Mr. Johnson, aye. Mr. Nunez? Mr. Teaberry? Mr. Teaberry? I couldn't hear you. Mr. Teaberry, aye. Mr. Reichert? Mr. Reichert, aye. Mr. Roscom? Mr. Roscom, aye. Mr. Buchanan? Mr. Buchanan, aye. Mr. Smith of Nebraska? Mr. Smith, aye. Ms. Jenkins? Ms. Jenkins, aye. Mr. Paulson? Mr. Paulson, aye. Mr. Marchant? Ms. Black? Mr. Reed? Mr. Kelly? Mr. Kelly, aye. Mr. Renacci? Mr. Renacci, aye. Mr. Meehan? Ms. Nome? Ms. Nome, aye. Mr. Holding? Mr. Holding, aye. Mr. Smith of Missouri? Mr. Rice? Mr. Schweikert? Mr. Schweikert, aye. Ms. Walorski? Ms. Walorski, aye. Mr. Curbelo? Mr. Curbelo, aye. Mr. Bishop? Mr. Bishop, aye. Mr. Neal? Mr. Neal, no. Mr. Levin? Mr. Levin, no. Mr. Lewis? Mr. Lewis, no. Mr. Doggett? Mr. Doggett, no. Mr. Thompson? Mr. Thompson, no. Mr. Larson? Mr. Larson, no. Mr. Blumenauer? Mr. Blumenauer, no. Mr. Kind? Mr. Kind, no. Mr. Pascrell? Mr. Pascrell, no. Mr. Crowley? Mr. Crowley, no. Mr. Davis? Ms. Sanchez? Ms. Sanchez, no. Mr. Higgins? Mr. Higgins, no. Ms. Sewell? Ms. Sewell, no. Ms. Del Bene? Ms. Del Bene, no. Ms. Chu? Ms. Chu, no. Mr. Nunez? Mr. Nunez, aye. Mr. Marchant? Mr. Marchant, aye. Ms. Black? Ms. Black, aye. Mr. Reed? Mr. Meehan? Mr. Meehan, aye. Mr. Smith of Missouri? Mr. Rice? Mr. Rice, aye. Mr. Davis? Chairman Brady?
Aye.
Chairman Brady, aye. Mr. Chairman.
Clerk will report the vote.
22 yeas, 15 nays.
There being 22 ayes and 15 noes, motion table is agreed to. Are there any other amendments to the amendment in nature of substance?
Mr. Chairman, I have another amendment at the desk.
Gentleman is recognized for purposes of offering his amendment. Mr. Reichert?
I reserve a
Mr.
point of
Reichert
order.
reserves. The gentleman would suspend while the amendment is distributed.
Thank you.
Gentleman, text is recognized for purposes of offering his amendment.
Thank you very much, Mr. Chairman. Mr. Chairman, 60% of all Americans across the political spectrum call lowering the cost of prescription drugs one of the top healthcare priorities. Americans and their pocketbooks are calling out for relief, but this committee has not heard them. There's strong support for Medicare negotiation and transparency, among other solutions. The AARP found that retail prices for brand name drugs widely used by older Americans increased by more than 15% in 2015, almost 130 times faster than the general cost of living or inflation rate. The average older American takes more than 4 prescription drugs a month and can quickly run up a bill that exceeds their actual income through Social Security. More than 70% of Americans want an independent group that will review the pricing of prescription drugs, an independent group that might look something like the Independent Payment Advisory Board that this bill proposes to abolish. Now, despite broad support across the political spectrum for fighting drug price gouging and requests that I have made joined by a number of members of this committee, we have been unable for more than a year to even secure a hearing on the problem of rising, soaring prescription drug prices and the various approaches that might be taken to address it. At a recent hearing before the committee, I sought the very modest step of simply trying to get more accurate data collection on Part B drug prices, because this is not only a problem for individual seniors and other consumers, it is a very big problem for the Medicare system, the Medicaid system, and any public health program when prices are rising as fast as they are today. Even that small step of getting accurate data about what drugs cost under Part B was rejected by this committee. Indeed, the only thing this committee has done of any significance concerning drug prices over the course of the last year was to provide brand name pharmaceutical manufacturers with a $28.5 billion tax windfall and requiring absolutely nothing in return. Fortunately, that has been stopped, at least for now, over in the Senate. President Trump has continued to speak out, using very dramatic terms about what is happening with drug prices. He called it getting away with murder. But we cannot even secure a hearing in this committee concerning this matter. That is why this amendment simply seeks to have the IPAB continued until such time as drug prices are rising at the same rate as that of inflation. Our Medicare recipients, our taxpayers, deserve some relief from price gouging and massive price hikes. You know, it has become rather standard if you have a dread disease, cancer or any other type of disease of that magnitude, that the cost of treatment is at least $100,000. And that happens over and over again, not just with oncology drugs. But within the last few weeks, we've seen that that's no longer the standard. One new medication that is out is being offered at a price of $475,000. Those are prices that will break public health programs and break individuals. Certainly, we want incentives for new developments, for research, but a drug that is unaffordable provides no technological benefits for curing disease or preventing death. This amendment would give the committee an opportunity to consider what it has denied in the past, and that is an opportunity to protect people across the country from prescription price gouging. And since it may not take full effect, it will give us some time in the meantime to have the hearings and explore the alternatives that might give Americans an opportunity to deal with prescription price gouging and to get the health care they need at a price that they can afford and that taxpayers can afford. So I urge adoption of the amendment.
Thank you, Mr. Reichert.
I withdraw my reservation.
The gentleman's point of order has been withdrawn. Mr. Tiberi, you're recognized to speak.
Mr. Chairman, I would like to speak against the amendment. While I certainly understand and share the gentleman's concern regarding the increased cost of prescription drugs, particularly oncology drugs, as he said, Congress shouldn't wait any longer to actually repeal this damaging board that we've already talked about today, Mr. Chairman. And that's what this legislation does. Why should we wait to allow for unelected bureaucrats, essentially, to take power away from duly elected members of Congress? The amendment would do that. So I urge my colleagues, both Democrats and Republicans, to not delay this any further and vote this amendment down.
Mr. Tiberi yields back. Is any member wish to speak on the amendment? There being no further speakers, Mr. Crowley, you're recognized.
Chairman, I yield my time to Mr. Duckett.
Well, I would just say to Mr. Tiberi, you can have it both ways. If you insist on repealing this provision and knowing that it will have no effect for 3 or 4 years, then you have plenty of time, as you've had in the past year, to explore the tremendous impact that price gouging on prescription drugs is having on American families. Whether it is the EpiPen crisis or it is the soaring cost of oncology drugs and the prospect that to address a condition the cost will be $475,000. Or it is the way that new treatments for hepatitis have threatened Medicaid programs across the country. These are problems that this committee has simply been unwilling to consider or address or hear expert witnesses on at a time that it threatens the solvency of our health care programs, and it threatens financial ruin for families that find themselves not only facing a diagnosis of a dread disease, but a prognosis of financial ruin. This amendment is simply saying, don't repeal one mechanism that Big Pharma has been trying to repeal. They are, after all, one of the chief cheerleaders for repealing the Independent Payment Advisory Board. So if you want to see it repealed, then get in place a mechanism to address soaring drug prices, such as Medicare price negotiation, something that President Trump has endorsed in the past. Consider the possibility of permitting the importation of drugs that meet safe standards from Canada, where they're available at much lower prices. Consider the problems where generics cannot enter the market and let the marketplace work with competition by stopping some of the practices that are blocking generic drugs from getting on the market and providing less expensive alternatives. There are a wide range of ways, and no one of them by itself will solve this problem of prescription price gouging, but we need to act, and we need not to defer that acting. So this amendment is only out there as a way to try to force action on this problem, and since no other legislation can be brought in front of the committee, to simply say this is a mechanism to force that action that Americans have been demanding. I would urge adoption of the amendment as a way of speaking out on the terrible problem of prescription price gouging, and hopefully it will lead to some resolution of this matter, and I urge adoption of the amendment. I thank my colleague, Mr. Crowley.
Does anyone else wish to speak on the amendment? Questions on agreeing the amendment offered by Mr. Doggett. All those in favor signify by saying aye. Aye. Those opposed, no. No. Opinion of the chair, the noes have it. A roll call is requested. The clerk will call the roll.
Mr. Johnson? Mr. Johnson, no. Mr. Nunez? Mr. Nunez, no. Mr. Teaberry? Mr. Teaberry, no. Mr. Reichert? Mr. Reichert, no. Mr. Roscom? Mr. Buchanan? Mr. Smith of Nebraska? Ms. Jenkins? Mr. Paulson? Mr. Marchant? Ms. Black? No. Ms. Black, no. Mr. Reed? Mr. Kelly? No. Mr. Kelly, no. Mr. Renacci? Mr. Meehan? Ms. Nome? Ms. Nome, no. Mr. Holding? No. Mr. Holding, no. Mr. Smith of Missouri? Mr. Rice? Mr. Schweikert? Mr. Schweikert, no. Ms. Walorski? Ms. Walorski, no. Mr. Curbelo? Mr. Curbelo, no. Mr. Bishop? Mr. Bishop, no. Mr. Neal? Mr. Neal, aye. Mr. Levin? Mr. Levin, aye. Mr. Lewis? Mr. Lewis, aye. Mr. Doggett? Mr. Doggett, aye. Mr. Thompson? Mr. Thompson, aye. Mr. Larson? Mr. Larson, aye. Mr. Blumenauer? Mr. Blumenauer, aye. Mr. Kind? Mr. Kind, aye. Mr. Pascrell? Mr. Pascrell, aye. Mr. Crowley? Mr. Crowley, aye. Mr. Davis? Ms. Sanchez? Ms. Sanchez, aye. Mr. Higgins? Mr. Higgins, aye. Ms. Sewell? Ms. Sewell, aye. Ms. Del Bene? Ms. Del Bene, aye. Ms. Chu? Ms. Chu, aye. Mr. Roscom? Mr. Roscom, no. Mr. Buchanan? Mr. Buchanan, no. Mr. Smith in Nebraska? Mr. Smith, no. Ms. Jenkins? Ms. Jenkins, no. Mr. Paulson? Mr. Paulson, no. Mr. Marchant? Mr. Marchant, no. Mr. Reed? Mr. Renacci? Mr. Renacci, no. Mr. Smith of Missouri? Mr. Rice? Mr. Rice, no. Excuse me, I missed Mr. Meehan. Mr. Meehan, no. Mr. Davis? Chairman Brady?
No.
Chairman Brady, no. Chairman Brady?
Clerk will report the vote.
15 yeas, 22 nays.
There have been 15 ayes and 22 noes. The amendment is not agreed to. Are there additional amendments to the amendment in nature of a substitute? If there are no further amendments, questions on the adoption amendment in the nature of substitute. All those in favor signify by saying aye. Those opposed, no. Opinion of the chair, the ayes have it. The amendment in the nature of substitute is agreed to. I'll now recognize Mr. Johnson for the purpose of offering a motion.
Mr. Chairman, I move the committee favorably report H.R. 849 as amended to the House of Representatives.
Questions on favorably reporting the bill H.R. 849 as amended. All those in favor signify by saying aye.
Aye.
Those opposed, no. Opinion of the chair, the ayes have it. The motion is agreed to and H.R. 849 is amended. It's ordered favorably reported to the House. Roll call is requested. Clerk will call the roll.
Mr. Johnson?
Aye.
Mr. Johnson, aye. Mr. Nunez? Mr. Nunez, aye. Mr. Teaberry? Mr. Teaberry, aye. Mr. Reichert? Mr. Reichert, aye. Mr. Roscom? Mr. Roscom, aye. Mr. Buchanan? Mr. Buchanan, aye. Mr. Smith of Nebraska? Mr. Smith, aye. Ms. Jenkins? Ms. Jenkins, aye. Mr. Paulson? Mr. Paulson, aye. Mr. Marchant? Mr. Marchant, aye. Ms. Black? Aye. Ms. Black, aye. Mr. Reed? Mr. Kelly? Mr. Kelly, aye. Mr. Renacci? Mr. Renacci, aye. Mr. Meehan? Mr. Meehan, aye. Ms. Nome? Ms. Nome, aye. Mr. Holding? Mr. Holding, aye. Mr. Smith of Missouri? Mr. Rice? Mr. Rice, aye. Mr. Schweikert? Mr. Schweikert, aye. Ms. Walorski? Ms. Walorski, aye. Mr. Curbelo? Mr. Curbelo, aye. Mr. Bishop? Mr. Bishop, aye. Mr. Neal? Mr. Neal, no. Mr. Levin? Mr. Levin, no. Mr. Lewis? Mr. Lewis, no. Mr. Doggett? Mr. Doggett, no. Mr. Thompson? Mr. Thompson, no. Mr. Larson? Mr. Larson, no. Mr. Blumenauer? Mr. Blumenauer, no. Mr. Kind? Mr. Kind, no. Mr. Pascrell? Mr. Pascrell, yes. Mr. Crowley? Mr. Crowley, no. Mr. Davis? Ms. Sanchez? Ms. Sanchez, aye. Mr. Higgins? Mr. Higgins, no. Ms. Sewell? Ms. Sewell, no. Ms. Del Bene? Ms. Del Bene, no. Ms. Chu? Ms. Chu, no. Mr. Reed? Mr. Smith of Missouri? Mr. Davis? Chairman Brady?
Aye.
Chairman Brady, aye. Chairman Brady,
Clerk will report the vote.
24 yeas, 13 nays.
This vote, the ayes are 24 and the noes are 13. The motion is agreed to. H.R. 849 is amended as ordered favorably reported to the House without objection. As staff be authorized to make technical and conforming changes to the bill, the members have 2 additional days to file with the committee clerk supplemental, additional dissenting, or minority views. There being no further business for the committee stands adjourned.
Great.